certain activities, and then as people think about them and understand the consequences of not doing everything we can to combat this virus, they kind of integrate that in with their thoughts and say, okay, I understand now that I need to take different action. It might be at my house of worship or an individual standpoint. So I just want to say thank you for the community, to the community, for that kind of understanding. I mean, the bottom line on this is, you know, we're in uncharted territory for most of us during our lives, but we have the advantage of seeing what's happened in other countries here in the last 2 months or so that gives us a good solid foundation for knowing that we need to act aggressively as a community, and the community starts with each one of us with our individual actions that we take, either just in our own daily life or as leaders that have responsibility for making decisions about their nonprofit, their house of worship, their business, whatever it might be. So I just want to say thank you to everybody and welcome you to kind of continue this journey of understanding with us, with all of us sharing the same goal, and that is to make sure that we all stay safe and healthy. I'd like to thank the Metro Council for their partnership and cooperation throughout this endeavor as well. Obviously, we need a strong executive branch with the mayor and a legislative branch with the Metro Council to run our city in a very smooth fashion that our people certainly deserve. So I really want to say thanks to the council for their partnership during this time. Marcus Winkler is going to speak on behalf of the council with another example of some of their supportive activity. Marcus Winkler.
Thank you, Mayor. Thank you, Mayor, and thank you to the administration. We understand that people are concerned with this unprecedented event that's going on that we're having to work our way through, and what we're trying to do is ensure that Metro government has the resources available to deal with it. So on Monday, we'll be entering an ordinance to take the surplus $2.7 million that we had earmarked for the pension and propose moving it to the Office of Resilience for emergency housing and food funding. So basically, citizens should know that if their income sources are impacted through any sort of work stoppages, furloughs, those sorts of things, that they don't need to worry that they're going to go hungry, and they don't need to worry that they're going to be homeless, that we will have those resources available. The exact mechanism for how that will be deployed, we're currently working through with the administration through the Office of Resilience, what the qualifications are should we need the money, but we want to make sure that it's available in case it is needed. And I want to thank Councilwoman Dorsey, President James, both Republican and Democratic members of the council. We hope to have universal support behind this to push it on Monday. Thank you.
Okay, likewise, thanks to President James, Councilwoman Dorsey. And are you guys got to go to a budget meeting right now? So if y'all need to scoot out, we understand that as well. So thanks for all of your support. As Councilman Winkler indicated, these funds would be distributed and managed through our Office for Resilience and Community Services. And Tamika Laird is the director of that organization. I just want to recognize her right here behind us, and she will be reviewing plans for how we might utilize the funding provided by the council to help our most vulnerable through this time. It was yesterday also there was a question about the financial readiness of the city to deal with some of the potential impacts of the virus, and I reported then that one of the things that we have been doing throughout all of our budget cycles, including this last one where we've faced some very challenging situations, is we have kept our rainy day fund healthy to prepare us in the case the city ever had to go through an emergency. So I just want to reiterate that fund is healthy with approximately $74 million in it in case we need to tap into it for any other reasons as well. Now let's get a health update from Dr. Moyer, who her and her team have been working tirelessly through this over the last week or so. So I really want to thank our public health and wellness team and department and our leadership, Dr. Moyer and her team. Sarah Moyer.
So thank you, Mayor. Just want to follow up with the update. We still have one confirmed case of COVID-19 here in Jefferson County, but are expecting more to become positive in the coming days and weeks. So just following up on the mayor's announcement and just about events and social distancing from yesterday. This is very important. We can stop the spread of disease by staying away from each other. We stay away from each other to avoid catching or spreading disease. The data shows us that our risk is highest if we allow people to continue to gather or go around business as usual. So if you have social media in front of you, you can Google a graph between this and the Spanish influenza flu of 1918 and the difference in response between Philadelphia and St. Louis. The cases were being reported in early September. Officials in Philadelphia continued to allow public gathering and disease spread. In St. Louis, cases were reported in early October with measures to contain the spread enacted just a few days later, and it resulted in a slower spread and a lower death rate. So we want to flatten the curve just like St. Louis did, or even better. And this will allow us, for our healthcare system, be able to respond and take care of all of us that is needed. So simply put, we can curb disease transmission and risks of exposure most effectively by implementing the measures that the mayor is going to go into more details about today. So please practice social distancing, work from home if possible, don't attend church, as Governor Beshear announced, and recommending not getting on an airplane if you do not need to. So we understand there's a lot of anxiety and confusion and fear, but these are sound measures to protect us. All of us have a really big role to play, and this is how we can all stop the spread of COVID-19 and reduce the risk of serious illness and death. So the second thing I really want to address is what to do if you think you've been exposed to coronavirus or COVID-19. So this is really an important point. Our hospital systems are already getting overwhelmed with calls and people showing up concerned about being exposed to others with COVID-19. So just want to remind you that the data from around the world and other states tell us that 80% of us, and 80% of those who get infected with COVID-19 have very mild illness and don't require any clinical interventions. They've been able to stay at home and treated with over-the-counter products, just like you would with a common cold, and recover. And then also want you to remember that what exposure means. It means you have to have been within 6 feet or less of a person with the virus while they have symptoms for 20 minutes or longer. So if you think you've been exposed, please monitor yourself for symptoms. These symptoms are fever, cough, and shortness of breath. If you have not developed the symptoms within 14 days, you're in the clear. And if you do develop mild illness, a slight fever, a cough, please stay at home and treat yourself as you normally would. You do not need to call your healthcare provider. You do not need to go get evaluated or tested. So please, if you have mild illness, do not tie up our healthcare resources. Our healthcare systems have to be available to help those who are the sickest. And then another thing I want to address is about testing. There's a very limited amount of testing available to local communities right now, and we are reserving these tests for those who are the sickest and meet CDC guidelines of having traveled to an area with community-wide infection, a close contact of someone with the infection, and you have symptoms. The only people who are allowed to test are healthcare providers. The local health department is not a provider of testing. So just to remind you, 80% of those who get infected with COVID-19 have mild illness and don't require any clinical interventions. So if you have slight fever, cough, please stay at home, treat yourself as you normally would, just do not have contact with others until you have recovered. But if you're severely ill, please call your healthcare provider to let them know your symptoms and follow their direction to go to the ER. And then also a reminder that those at greatest risk of developing severe outcomes are those over 60 and those with chronic medical conditions like kidney disease, hypertension, or diabetes. Thank you. I'm going to turn back over to the mayor.
Thank you, Dr. Moyer. Governor Beshear is having a press conference today at 5 o'clock in about 8 minutes or so. And if there are new positive tests, he will announce them at his press event. Okay, but again, we are expecting additional cases. We know they will come. We see this all over the world right now, so we just want to make sure when people see this that they understand it's part of the natural process that comes with the pandemic, where it increases before it starts decreasing. But we can do a lot here to make sure that the pandemic does not reach the size that it potentially could without intervention. We really want to capitalize on the learnings that we have seen by studying other places in the world that have experienced this pandemic before it has hit our city. So we know that global data and data from other cities in the United States show us that the very best way to prevent COVID-19 from spreading is to severely restrict our interaction with other people. And that's why we're making all these recommendations that we are. Recent social distancing intervention models out of Seattle, that's King County in Washington, and Snohomish County in Washington, shows that quickly implementing restrictive social distancing is the most effective way to significantly reduce exposure to COVID-19. So when you make a decision not to go to an event, or you make a decision to cancel your event, you are being a great citizen and contributing to lessening the potential impact of this virus. Please don't look at it as an inconvenience. Look at it as an act of citizenship on behalf of yourself, and behalf of the community, and behalf of the people that you love. I just want to encourage for people to think about that with every action they take up, whether they go to bed at night thinking about that, or whether they get up in the morning thinking about this. This is just going to be our new normal for a little while before this peaks and goes away. So we know that the earlier we can act to reduce the person-to-person spread, the less transmission will occur, and the fewer people then will be seriously impacted, including those at the highest risk of becoming seriously ill or dying from the disease. And so that's the best way, too, to make sure we have the capacity at our hospitals. So for those that are most severely impacted, they will have the availability at the hospital. So all of these actions add up over time, and that's why we're asking you to think about what your individual action can be. We have to think about what our community actions are as well. And that's why, effective immediately through April the 5th, I'm ordering that all events hosted or permitted by Louisville Metro government or held in a Louisville Metro facility will be postponed or canceled. I want to repeat that. Ordering now through April 5th, all events that are hosted or permitted by Louisville Metro government or held in a Louisville Metro facility will be canceled or postponed. Fortunately, we're seeing a lot of people take this action on their own, and we appreciate that. We're recommending that all other events in the city be postponed or canceled as well, at least through April 5th, so we can take a look then. We'll know more in the coming days to see if we need to extend that. Take action like the Ancient Order of Hibernians did yesterday to postpone the St. Patrick's Day parade on Saturday. It's that kind of responsible leadership that we appreciate here in our city. For the city, the cancellation includes such things as our library activities, so library story times, and permitted events such as the Nulu Bachfest and the leg of the Triple Crown Marathon that had been planned for this weekend. Also, we have to shift our compassion focus. Most of our city knows that we're an international model city of compassion. We've been named that multiple times, and one of the reasons why we have that recognition is because of the incredible work that's done through our city with the annual Give a Day Week of Service. Last year, 235,000 volunteers and acts of compassion. So this year, we are going to show that we are both aware and compassionate by postponing our Give a Day Week of Service, which was to run April 15th through April the 25th. There's a lot of anxiety as people are looking forward to what events are going to be held, so I think it's best just to go ahead and say we're going to postpone it to take that kind of burden off of people thinking through all these what-if scenarios, and then we'll reschedule it for a later date. And then many of the events, key partners were saying they didn't feel good about going forward either. We didn't, so we said, okay, let's just go ahead and postpone that. So unfortunately, Give a Day is going to be postponed. Let's show our compassion in other ways. We've received some reports from some of our senior citizens being super concerned about their well-being because of all the emphasis on people that are older in our society that are at higher risk of morbidity. So see how you can exercise your compassion with those folks on an individual basis, whether it's making sure they have adequate groceries, checking in with them, keep the proper social distancing, but please exercise your love and compassion in that way while we figure out what we're going to do with Give a Day. We have a tremendous partner in Give a Day, and that's our Metro United Way. And of course, United Way provides so many critical social services directly and through their partners for our city. And I'd like to ask the CEO of the Metro United Way, Teresa Reno Weber, to share a few words with us. Teresa?
Thank you, Mayor. Thank you, Mayor. Thank you to our public health officials, to our Metro Council leaders for their courage and their commitment to the safety and well-being of everyone in our community. While we are disappointed that we won't be able to have the mayors give a day week of service, we know that that is the right decision to make, and we are working alongside our community partners to understand the needs of those nonprofits at this moment in time, not only for the individuals that they serve, but for their staff and their employees as well. Many of our partners are serving those in our community who are at the highest risk. And we know that as they continue to make difficult decisions about canceling events, many of which are revenue generating for them and their organizations, this is the time where we need our community to stand up and those who are able to look for other ways to provide support, whether that's financial support or reaching out to individuals to understand what they may need for their particular situation. Metro United Way and our team is doing that right now, and we'll continue to communicate through our social media and on our website about the needs that we are working alongside our partners to meet for both their organizations and all of the individuals that they are serving in our community. For each of those partners that we had a Mayor's Give a Day event planned for, we will continue to look for opportunities when the time is right to fill and meet those needs alongside all of the individuals here on this stage and in our community. I know that it is a moment where we need to socially distance ourselves, but we also know that this is the time when we most come together and truly practice living united through compassion and other acts that are going to be able to help us weather this current situation and come out stronger on the other side.
Thank you, Teresa. We also have Matt Gibson, the CEO of the Kentucky Derby Festival, with us, and he is going to share a few words. Matt?
Thank you very much, Mayor. As we've all witnessed in the last 24 hours, we're in such a different space than we've been before here in Louisville, across the country and around the world. This isn't just about events and putting on entertainment. This is about public health and safety, and at the Derby Festival, that is always our top priority, no matter what we do. In support of the efforts taken by the Centers of Disease Control, Louisville Metro Public Health, the Derby Festival is going to postpone the events we have on our schedule through April 5th in solidarity as well. Those events include things like the Spelling Bee, the Student Art Contest, Academic Challenge, the Spring Fashion Show, and the Phillies Derby Ball and FamFest. We're looking at alternatives to road race training events and some smaller private events scheduled during that time. And just at home, processes for our committee and board meetings will be changing, and our staff will be able to work from home as they continue to plan for and address the 2020 festival well over a month away. We are contacting all those involved with the postponed events to make sure they are aware of the changes, because you can imagine that's very, very far-reaching. Once we have those events rescheduled, we will let everyone know, and obviously that will be based on what feedback we're getting from our partners at that time. And again, only the events right now are the ones that we're looking at through April 5, but we will be addressing the entire festival as the need arises. We have the responsibility to the community who has supported the Derby Festival for well over 60 years to do our part in this effort as well. As we've been over the last several weeks, we'll be in constant contact with the mayor's office, the governor's office, and all the other agencies to closely monitor the developments and announce any additional changes as needed. As the mayor has expressed, we have a new normal in this community, and we're all wrapping our heads around it at the same time. We're all adjusting to that. Public health and safety is our top priority, and making sure that we're doing the right thing is paramount over everything else. We couldn't put on our events without this community and the support that we get from our community support, our partners, and those who attend our events, so it's our responsibility at this time to be responsible in that discussion. Thank you.
Thanks, Matt. I appreciate your great leadership and responsible decision-making. And look, the Kentucky Derby Festival belongs to all of us, so this is all of our way to kind of contribute as we evaluate next steps of what we're going through. And years from now, we'll look back on this and say, remember how we contributed to getting through this virus in a very quick and efficient fashion. So that's a way we can all can participate. In other updates, this morning I joined about 135 internal and external partners for a virtual preparedness exercise at the MetroSafe Emergency Operations Center. What we wanted to do was pull broad members of the community together to ensure that we were all on the same page about how we would handle a community spread of the COVID-19 virus. So, you know, the way you build skill, obviously, is to practice and work out bugs in advance. So this morning's exercise further emphasized to us the obvious importance of communication and coordination, and how interdependent Metro is with its community partners, and why it's so important that we know each other's plans and capabilities, and how we will work in tandem in the event of a community spread or other various scenarios. So we exercised those plans and coordination this morning by talking through multiple very realistic scenarios, from relatively simple to extraordinarily complex. And I really appreciated the contributions, the questions and concerns that we heard that will only make us better. That's why we run these scenarios, and our citizens should understand that we're practicing right now. Hope we don't have to use this, but you never know, and we've got to be ready, and you deserve that. So it further ensures that we'll be ready if a situation involves. So let me just share a couple of the specifics with you. We heard from the Louisville Regional Airport Authority, from our Muhammad Ali International Airport, on the protocols in place to assess and deal with sick passengers. So the scenario was, we've got a plane coming in, there's someone that's been sneezing, short of breath, high temperature, notifying the airport authority in advance. What would you do? Then when the plane lands, people start calling, people saying, uh-oh, we've got somebody on the plane. What happens then? What happens when the police shows up? How do you get an ambulance there? How do we make sure hospital facility is ready? And then how do we best contain the situation and track any other folks that could have been affected by this? We heard from the Kentucky Derby Festival, obviously a community jewel that's coming up closely, on the extensive planning that they've been taking. And then we ran kind of a worst case scenario based on what we're learning in Italy, again, where the healthcare system gets overwhelmed by the number of people that are coming for testing, that have the virus, that run out of bed capacity, that run out of people to help. What are we going to do? How do we seek help in something like that? So the last thing you want to do is practice that for the first time when and if it happens. So we learned a lot when we went through all these different scenarios, and we will continue to practice in the event that we need to exercise this skill that we're building. And then, of course, our public health and public safety agencies shared how they will coordinate with everybody in between all of these activities to make sure that we are as efficient as we possibly can be. And finally, we talked about how we stay in contact or constant communication with the public, and how each agency will communicate the most recent, timely, and accurate information. So we've got a really good communications team here. Jean Porter and her team, I want to thank you guys for staying like on top of this like you did so well. I mean, the community can think back to when Muhammad Ali passed away, and how seamlessly, really, we communicated with the rest of the world on the passing of the champ. And that happened because we marshaled all of our resources here at Metro government, especially with communication, to support the global need for information. So with the thirst for information that people have during this COVID-19 experience, we're coordinating all of our communication assets from Metro government to make sure that you're getting the right information at the right time in the volume that you want. So if you need to know anything else, please let us know, and we will provide that information. For Louisville City government, as we know, just to reiterate, the number one job we have is to protect the public, and we are committed to communicating in a transparent manner as fast as we can, and safeguarding all of those involved. And to close out here, you know, we're just going to go through, again, the simple steps that everybody can take. I know people here in the media gets tired of hearing this, but sometimes people are listening in for the first time. So we want to go through what those simple steps are that you can keep yourself safe and keep others safe. So number one, right, is to wash your hands with soap and warm water for 20 seconds. If you don't have soap and warm water, some type of sanitary solution, but 20 seconds. And then avoid touching your eyes and your nose or mouth. Cough or sneeze into an elbow or a tissue. Throw the tissue away after that. Most importantly, if you are sick, stay home, okay? And monitor yourself. You say call your health provider if things start getting worse. Avoid going to a hospital as a last case after you checked with your health provider so we can ensure there's capacity at the hospital. So stay home if you're sick. And then for other folks, avoid contact with sick people. And that can be hard to do, obviously, if it's someone that you're caring for, but make sure they're taken care of without involving yourself and yourself getting sick as a result of that. And then last thing is, I'm still surprised. When I'm out in the community, I'm seeing a lot of people still shaking hands. And some people are like, oh, come on, this thing's not that serious, or they're kind of macho about how they're doing it. The virus doesn't care how macho you are, okay? It can affect everybody. So when you're shaking somebody's hands intentionally, just kind of blowing this off, you're doing a disservice to yourself and our community. So I just ask everybody, to go with the elbow bump or fist bump. No, don't do fist bump, but elbow bump or knee bump or foot bump, whatever you want to do. But please stop shaking hands for the time being here until we get through this potential virus. So go with the elbow bump. And then if you have any questions, remember kind of the definitive source of knowledge for this is the Kentucky Coronavirus Hotline that's up on the screens at kycovid19.ky.gov or 800-722-5725. That's where you can get the straight scoop on this, not from your social media accounts that are out there. All right? So now I'd like to ask Jody Myman, Director of Emergency Management, to come up because we got another issue, of course. This is like, welcome to the mayor's office, by the way. It's usually we're not dealing with a coronavirus, but there's always something going on. You never know what it is or when it's going to happen, but it happens most every day. So today we have the added complication of some potentially severe weather coming into the area, and Jody Myman, our Director of Emergency Management, is going to talk about that. Jody?
Sir. Thank you, Mayor. So like you said, along with monitoring and assisting and coordinating with the coronavirus issue that we're dealing with, we're also monitoring severe weather. Things don't stop and other things do come up. So right now we're monitoring some severe weather that can come in, potentially now, obviously, that some rain coming in now. Through this evening, sometime about after 10 o'clock, and this is an all hazards type of storm, so it's like a spring storm. We can have a lot of wind, a lot of hail, and heavy rain, so make sure that you're paying attention to all your local weather resources. If there's actually a tornado watch that's out to the west of us right now, which could move to the east into our area. But again, stay safe, stay informed. If you're out driving tonight and encounter high water, as always, turn around, don't drown. And then sign up for Lens Alert, Louisville Emergency Notification System. Go to louisvilleky.gov, sign up, download the Smart 911 app, fill out a profile, and get the latest weather information, again, as quick as we can give it to you. Thank you.
Thank you, Jody. We're coordinating with our federal partners as well regularly on this. I want to recognize Nicole Yates representing Congressman Yarmouth's office here. So we're dealing with our Congressman's office, the White House, and making sure that we're coordinating any type of federal response that will be assisting us as we go through this and the aftermath of this as well. We're in regular contact with the governor's office. I want to share the governor just confirmed at his 5 o'clock that we do have one new case here in Louisville. The individual is in isolation, and we'll provide more information on that as we can when it becomes available. All right, with that, we're happy to take any questions. I cannot confirm if that's the Humana worker because I don't know. Yeah. Sarah, do you want to take that too?
Yeah. Emergency rooms will take people with insurance or without insurance, so just encourage anyone who has severe symptoms, please call the emergency room first and please show up if you have severe symptoms.
And I know that the governor, and correct me if I'm wrong here, but has waived co-pays and any kind of financial barrier to getting a test. So that message should be loud and clear. As Sarah just said, if you suspect that you have symptoms, get checked. Pardon me? Metro Council at this point will continue to meet. I mean, I anticipate they will, practice good, safe hygiene while they're doing that. So they're having their budget meeting right now. We have, people have asked, should they continue with individual meetings that they have? So I just would say again, think about the situation, and if your meeting can be held via telephone or a teleconference of some kind, there's a lot more of that being used. Just go ahead and communicate that way, or if you need to cancel or postpone it, do that as well. And then if you absolutely have to hold it in person, just follow the guidelines that we have been communicating regularly, that I will spare you from hearing it from me once again, but social distancing, hand washing, etc. Okay? I'll start, and Sarah, if you want to communicate. Our health department is in contact with the health departments of origin where these folks are living to understand any nature of the spread that is relevant to us. But Sarah, do you want to add anything to that?
Yeah, just to add that I know that it can seem frustrating that it's taken a while for information to be slow to come, but we are working with multiple health departments across the country to obtain the necessary information to make an educated conclusion about the concerns that are being raised. So we are concerned about the potential link between the cases and the possibility that exposure happened at the conference, but we want to make sure we have the most accurate information to guide our recommendations. Mm-hmm. No, all the indications show that all the cases that we know about were not infectious when they were in Louisville. What we're trying to investigate is if there's a possibility that they all got it while they were at the conference.
And just to be clear, because one of the initial cases, the conference was on the 22nd, and people from the conference were going to their positions as early as the 27th. Is that time frame enough so that they may have been asymptomatic but contagious while they were?
No, the average incubation period is about 5 days. So just looking at that timeline, they were not infectious when they were in Louisville.
You're positive about that? What's that based upon?
Just data that we're seeing nationally. There's a lot of cases nationally and internationally just to show that incubation period and when people are contagious or not contagious.
I want to share also that the governor just announced a recommendation to close all public and private schools effective Monday for 2 weeks. And then, of course, spring break comes after that, so schools will be out of session for 3 weeks. So hopefully people have been thinking about this eventuality in terms of childcare and such. And of course, that recommendation is made on the learnings that came out of China, that while fortunately our younger folks, children, are seemingly being spared from really negative impact from the virus, they can get the virus at school and then they take it home, and then when they hug mom or dad or grandma or grandpa or whomever it might be, the virus was spreading that way. So that's the reason behind the closing of the schools. All right, anything else? All right, folks, well, we know this is unusual territory we're on, but hopefully you see the actions that we're taking and the actions that you can take. What we also see in learning from the other countries is this passes, right? So the real variable is the time that its virus is going to be with us, and that's where everybody can just look at themselves and say, what is it that I can do? And there's some inconvenience obviously associated with this, but it's much better to have this inconvenience in the short term than kind of long-term serious impact to our community. So thanks everybody for their help.